Now to growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know.
But what we know about coronavirus is that it's concerning. Although the risk in the United States right now remains low, we certainly know that just this week, there are increasing numbers of the virus happening in countries outside of China, South Korea, Italy, most notably. And so those concerns suggest that the virus is popping up in significant places around us. And we've got to be ready for that here in the United States.
Today, we are reporting 3,874 new cases for a total of 33 confirmed cases since the start of this pandemic. Excuse me, please.
Many schools around the world, as you know, have shut down, some for extended periods of time as this virus spreads. In the U.S., some schools in 7 states have temporarily closed as a precaution.
Hi, Dr. Norman. My name's Georgia, and the question is, I want to know when I can come back to my school with my friends.
Well, Georgia, that's a really good question. And first off, the reason you're not in school with your friends is because of the fact that this coronavirus, COVID-19, seems to be more prevalent, more common when people, whether they're kids or adults, gather together.
So what looks like a pizza oven to me is actually a $75,000, maybe $80,000 piece of equipment that's going to spend some time sorting out all the genetic material in here.
Public health security is homeland security. Our country is nothing without the health of its people, and we can all work together to ensure that we continue to support this response and decrease the potential negative effect.
We're going to leverage that information that we got from responding to H1N1, making sure we're prepared for that next flu pandemic to move forward. But we can't really make sure that we advance those efforts unless we have some steady funding and don't go through this perpetual sort of roller coaster cycle of funding for one thing that's limited to that, don't have the flexibility then to use it for the next thing.
Desperate new measures in some states to slow the spread of the coronavirus. As you can see, we are heading in the wrong direction, and we are heading there very fast.
Don the mask, don your cape.
What's your mask say about you? It says you care about others. So mask up and save lives.
The Association of State and Territorial Health Officials has never been more important than it has been during this response.
One, public health truly matters and there is a cost to chronic underfunding. Number two, we must commit to investing in a strong and capable public health workforce. And number three, public health data systems must be modernized so data move faster than disease.
Now that we have the opportunity to have a hard reset and to go forward, it's pretty difficult to say, I am going to go back to a system that I know was flawed, that I knew had difficulties. And we as leaders can't do that. And yes, it's going to be more painful to change it going forward, but that is an imperative for us.